Hello and welcome to 6 Minutes. I'm Gemma Collins. This week we're taking a closer look at the increasing use of social media and the role it plays within the world of health. At a talk this week at Sydney University, a panel of health professionals and marketing experts discussed how Twitter, Facebook and blogging can be used to communicate health messages to the public. Immunisation was a big topic of the evening, as concerns were raised about the influence anti-vaccine lobby groups have over patients through their use of social media. Research and Communications Officer at the Heart Research Institute, Dr. Rachel Dunlop, told the audience that when you type vaccination into Google, 71% of the website content is incorrect or misleading and does not rely on scientific research. She said parents deciding whether to immunise their children are being scared off by a bottomless pit of misleading information. So should doctors be using social media to ensure their patients are getting the correct information? We spoke to one of the panel members, Dr. Julie Leask, who is Manager of Social Research at the National Centre for Immunisation Research and Surveillance. She started using Twitter to get the latest research on immunisation into the public arena.
So you're also getting new generations of parents who are increasingly connected with each other online and through Facebook in particular. So, you know, as the young people of today reach their 20s and early 30s and become parents, they're going to be people who are increasingly connected with each other and using those platforms to seek out information from each other about immunisation. So in those spaces, I think GPs definitely have, and practice nurses as well, have a great potential to, you know, be engaging with people. When you do have parents who are questioning immunisation, that's where we know from research that the healthcare professional has a lot of sway. And it's at that point, however they choose to interact with parents, whether it be through social media or in the clinical encounter, that GPs can have a lot of influence. You know, divisions of general practice probably have a lot of potential to reach GPs and local patients with via Twitter, for example, and also in putting out health promoting messages. So I'm not sure if I think it's up to the individual GP to feel obliged to, you know, get on the social media bandwagon, but to certainly recognise the way that social media is influencing people and their patients.
Well, as social media gets even more popular, it's clear that we can expect to see its role develop in the world of health. I'm Gemma Collins. See you next week.